Hey guys, how you doing today? Good morning. How you all doing? I'm doing great. Happy Friday. It's a good day. So today we're talking about trypanophilia. I can't even say the word. Trypanophilia, fear of needles and how to overcome it. Let's check it out. Fear of needles and a related fear of sharp object, agemophobia, is surprisingly prevalent. Follow these expert tips to help you step up to the syringe. All right, so this is articles by Rosemary Black. I think we read down earlier in the week for her. It's her story here. When my then 9-year-old daughter Molly was diagnosed with type 1 diabetes, she developed the fear of needles or sharp objects, as well as technophobia, fear of needles, the other one's fear of sharp objects combined. And with good reason. Each day she had to endure multiple finger pricks, repeated blood glucose checks, and several insulin injections. In the initial months following Molly's diagnosis, my husband and I were in charge of managing her blood sugar, but we were eager to help her overcome her fear so she could slowly start to respond to her own diabetes care. One weekend I was out of town covering a conference for work, and my parents volunteered to help my husband with the kids during my absence. When it came to time for Molly's insulin injection, my dad told her he would give her $5 if she would do the injection herself. Never one to turn down money, Molly took up Grandpa on his offer, overcame her fear, and gave herself the injection of insulin shot. From that day on, she took over all her blood testing and insulin injections. Maybe offering a monetary bribe wasn't exactly the right thing to persuade Molly to overcome her fear of needles, but small rewards are actually recommended to help your kids get over their fears. Cool. Says Elizabeth Ackerman, she's a doctor, of Black River Health Services, Inc., Atkinson, North Carolina. When a child is afraid to give herself an injection, it's fine to offer a little reward occasionally, she says. But I wouldn't use food as a reward, as this can lead to unhealthy relationship with food. Food rewards can teach kids to expect food every time they accomplish something. Instead, thinking about non-food rewards, experience like a trip to the movies or shopping at a favorite store. So, what is the fear of needles? Let's find out. The fear of subculture is called agoraphobia. When it comes to many routine medical procedures, including receiving vaccines, having to prefer can impact your health. How common is it? Whether you're a child with type 1 diabetes who requires insulin injections or an adult needing a shot for a medical condition, needles spark fear. In fact, trypanophilia or fear of needles is surprisingly prevalent. About 25% of adults are afraid of needles, and about 7% of adults avoid immunization because of the fear. The phobia is also called imomophobia. You'll have to check the email. I can't pronounce it. Sorry, guys. Which Merriam-Webster defines as a morbid fear of sharp, pointed objects such as scissors and needles. Interesting. Do you have these fears? It's preventing you to get the vaccine from COVID? I don't know. Let me know. Leave a comment. I'd love to hear what your opinion is about this. The majority of children have a fear of needles, while estimates of needle fear range from 20 to 50% in adolescents and about 20 to 30% in young adults. Typically, the fear of needle decreases as people get older, and it's more common in females than males, according to systematic review and meta-analysis. Are you suffering from anxiety? Is anxiety quiz? What? Check that out. Symptoms of the fear of needles. Symptoms vary, but present when a person sees a needle or learns they need to receive a shot. The symptoms can be debilitating and may include anxiety, panic attacks, insomnia, feeling dizzy, blood pressure spike, racing heart. Avoid visits to the doctor or receiving medical care. What causes people to develop the fear of needles? I don't know. Let's take a look. Some people who fear needles have an associative fear, in which a traumatic event, usually psychological, triggers the fear of needles in the first place. In resistant fears, there is an aversion to being controlled or restrained. And in those who have hyperallergenic fear, there is actually a genetic sensitivity to pain. The pain is so unthinkable that the person would never subject themselves to such a pain, says Dr. McGee. Some individuals are so terrified of needles that they experience visceral response. There's a link there if you're not too sure. I'm going to check that out after this myself. When they get an injection with this, you get marked drop. With this, you get a marked drop in blood pressure that can lead to passing out. Dr. McGee says, people occasionally pass out during blood drawn. How to overcome your fear of needles. Here are some expert tips you can steal if you like for your help yourself get over the syringe. 1. Prepare the area with medications such as an ethical chloride supply or tropical anesthetic, like lidocaine. Either useful for superficial reduction of pain due to needle injection, Dr. McGee says. Also helpful is a jet injector, which works like injecting us through high pressure gas rather than needle, Dr. McGee says. Number 2, take the cognitive approach. Dr. McGee advises contemplating the worst that can happen and remembering that an injection is only temporary discomfort. Remind yourself that a needle is painful for a second, but when you process and fully understand what the suffering would be if you do not get the injection, it can help you more realistically. Number 3, practice deep breathing. Visualize yourself being in a comfortable place. Dr. McGee says, don't make your fear an enemy, but treat the injection as something that in the end will make you more comfortable. Number 4, try mindfulness and meditation. Start with a few minutes of mindfulness and then 14 minutes of meditation. Adekmer says, think of 3 things that you are grateful for, and then imagine your goal, long-term or simple, be accomplished, she says, like the meditation app Calm. Use that, was pretty good. It's a link here if you want to use it. Number 5, use the show and tell approach with children. When Nurse Akmer is explaining the injection process to a newly diagnosed child with diabetes, she demonstrates how she will do it, and carefully explains how each move she's going to make on the child. As the child watches her, next she demonstrates how to do it by injecting a needle into an orange. Then she lets the child play with the orange until the child is comfortable injecting the orange herself. Number 6, distract and desensitize yourself. To distract yourself, try imagining sitting on a sun-drenched Caribbean beach or another place you go to relax. While you give yourself an injection, for some people, desensitization is effective. Hold the syringe in one hand until your fear and anxiety start to subside. Go through all the motions of giving yourself an injection without actually pricking your finger. You can even hold a piece of ice there to numb the area, Mika says. This should make it easier when you're ready to do the actual injection, she explains. And that is it for the article, guys. Hope you enjoyed the fear of needles and how to overcome it. If you have any comments, I'd love to hear them. Thank you guys for listening and watching today, and have a great day.